So we heard from the doctors at the first roundtable about why young people should be concerned. Now let's talk about what the law says to young people with our next panel here. I'll do some introductions. Emily Bramer, welcome back to the show with Bramer Conley, LLC. Thanks for being here. Tim McBride, Washington University. Thanks for being here as well. And Jen Bursdale with Missouri Healthcare for All. So what provisions of Obamacare, the Affordable Care Act, would you say most closely relate and have an impact on this age range we are talking about?
Well, I think that the cost issue for young adults is going to be one of the main things that they need to be aware of and that needs to be addressed. When you look at what's happening with the rates from the community rating standpoint, currently in the state of Missouri, and you hear things in various parts of the country about what's happening with different states and with the rates, but in Missouri, you have a very wide spread between what somebody in their 60s and somebody in their 20s might pay for an insurance policy, whether they're on an individual policy or whether they're on a small group policy that has age-banded rates. And with the new community ratings that are going to come under the law, that's going to change. So the big question is going to be, are those folks going to be available for the tax credits? And if so, will the tax credits make up that difference enough so that that cost is still affordable to them? Go ahead.
I'm really excited about all of the new opportunities that there are for young adults under the Affordable Care Act. In the past, we had an insurance system that sort of assumed that by your early 20s, hopefully you've been on your parents' insurance, but at that point you're expected to be out of school in a full-time job, either with employer-sponsored health insurance or enough money to buy it on your own. And in today's economy, that's often not the case. Young people out of school are finding part-time jobs at first, they're taking a break year and going back for a graduate degree. So now we have a system where you can stay on your parents' insurance until you turn 26. You have better options for getting coverage if you don't have it through an employer. Just the provisions that you can't be denied coverage or charged more for having a pre-existing condition is going to help a lot of young adults. And of course, we know Missouri still has that important decision to make about the Medicaid expansion. And a lot of the people that would qualify for that Medicaid expansion fall in the young adults category also. We're talking about young people who are at the beginning of their careers. They're not always going to be in the sort of low income category, but starting out, they need a little bit of help, whether it's through the tax credits or the Medicaid expansion.
I think Emily told the story correctly. It's going to be a trade-off between whether the tax credits are going to be high enough to offset the effects of what's called the age banding. That's going to make it a little bit higher for the young people. So the way the premiums are going to be set up, it's tilted a little bit higher towards young adults.
So do we really know what it's going to cost?
Not yet.
When will we know?
Probably close to October 1st, unfortunately. But we may know sooner than that. They just haven't been announced yet.
The insurance companies have all that information.
Right,
I mean, everything had to be submitted and approved. So, I mean, that's already been determined. It's just when will that information be released? And I think most of them are also wanting to try to retain a competitive advantage, for as long as possible. But, there's a lot that I think young adults are going to need to be aware of. And I think one of the big things that's an issue is, when the law first came out over the last few years, you heard a lot of people saying, well, I'll just pay the penalty, it'll be cheaper, and I'll wait until I get sick or get hurt.
Not only have people said that, but that we've discussed just before we came on camera, in all transparency, there is a National Center for Public Policy Research, a conservative organization that has a study out that says young people would actually, in fact, be better off, especially in the first few years, by just paying the penalty.
I think be better is a misnomer. I think that cheaper would be accurate, but better off as long as nothing happens to them.
Right, cheaper doesn't always mean better off. It's cheaper not to have car insurance, but I don't think many people would argue that that's a better plan. It's cheaper, maybe, not to have health insurance until you get sick. And suddenly you can't get the care you need, you can't afford the care you need, or you get the care through the emergency room and now you're 24, 26, 28 and you've got $10,000 or more in medical debt that you've got to take on in addition to everything else.
Private plans aren't going away though. If I wanted to go back on esurance.com or whatever it might be, I could still do that myself if I can get a better rate than the exchange.
The way to think about the exchange is it's going to be einsurance.com as the marketplace expanded, essentially.
Well,
So.
Yeah, but I mean, in addition to the exchange, you're going to have a private marketplace. Not all of the
Right.
insurance companies are participating in the exchange. In
Right.
fact, a number of them, including big players like United Healthcare and Aetna, are not going to be participating in the exchange.
Right.
So those plans you'd buy outside of the exchange. However, to get these plans, the carriers are adhering to an open enrollment period, very similar to what is with Medicare. So if you don't take it when you're first eligible, and the first open enrollment period starts October 1st and it'll end March 31st of 2014, then there'll be an annual open enrollment period which will mirror Medicare. So it'll be October 15th to December 7th of every year. The only other way to get coverage in between those times is going to be if you have a special enrollment period event, like for example, you gain or become somebody's dependent, or you lose access to a qualified health plan under the law other than for not paying for it. So young people who don't maybe pay the bill and let their coverage lapse, they need to be aware of that.
How optimistic are you that we can get people signed up? I mean, this is a massive shift, a massive undertaking. You got to hear that 1 in 4 young people even knows about the exchanges.
We have a lot of work to do. The good news is there's a tremendous amount of energy going into it statewide. We've got a huge network of nonprofit organizations, community leaders, clergy, everybody throughout the state. We all know that we need to get the word out. We need to help people understand what the new options are. The marketplace is going to offer great opportunities to a lot of people, especially if they qualify for those subsidies. It's important too that even the private plans sold outside of the marketplace, a lot of them are going to have better coverage than they did before because they're going to be required to cover
New
what we call
regulations for
essential
them.
health benefits. So maternity care will be covered, mental health care will be covered, and none of those plans are going to be able to discriminate based on pre-existing condition or gender, which we know has been a huge problem, and that's affected young adults as well.
I think one of the things to understand is, what we just discussed, is it'll be 6 months to understand this. And that'll be some time for young people and others to try to navigate this. And you can work through this, and there'll be 4 or 5 different options within this, and then different insurance plans to choose from. So people don't need to choose right on October 1st. They can take 6 months to sort through it.